Cardiac arrest is defined as a sudden loss of heart function in a patient, affecting over 300,000 people in the US alone yearly, and it has a 90% mortality rate. Even if the patient survives this affliction, what are the next steps toward recovery? When a patient is resuscitated, what impacts their long-term outcome? Could they die again? And at the heart of our project goal, is someone the same person they were before CA?
As medical technology advances in the modern era, there's a growing need for a pivot towards a brain-centered approach to resuscitation. Yes, patients can be resuscitated, but what is their quality of life afterwards? Assessing cerebral autoregulation, flow, and metabolism is one way to prognosticate and intervene before further damage occurs. Yet there are no standardized protocols to mitigate this secondary reperfusion injury in the way there are centralized guidelines for CPR. The key to preventing further brain injury after resuscitation hinges upon understanding how alterations to cerebral blood flow and metabolic state before CA can affect it after CPR, and in turn improve neurological outcome after the return of spontaneous circulation. Through fully utilizing novel and established multimodal monitoring systems to measure these dynamic changes, we can target specific interventions to address each patient's unique needs.
Acutely, whether an individual was fasted before CA could help predict the autonomic regulation during CPR and guide more precise interventions. If we can anticipate how the body will self-regulate based on metabolic conditions, we might reduce the need for use of excessive drugs, avoid over or under perfusion, and ultimately improve neurological outcomes. In this way, determining if a patient was calorically restricted before CA can be the earliest predictor of recovery compared to other markers that occur during or after CA.
As working pre-medical students and as members of our communities and families, we've directly observed and cared for people suffering from ailments such as stroke, obesity, heart disease, and such. While we can empathize and treat their conditions without judgments, it's equally important to recognize how lifestyle can increase the risk of developing or worsening these conditions, such as through metabolic syndrome. While our project has not yet found significant correlations of cerebral flow metabolism to long-term neurological outcomes, we'll continue investigating functional impairment, memory, electrical brain activity, edema, and other correlations with oxygenation parameters obtained from multimodal monitoring. Although we have solid future directions, the past 6 months have not been without struggle. We've had to work through misunderstandings, disagreements, and setbacks, but all of that has strengthened our relationships and led us to critically think why we wanted to pursue this project and medicine as a whole.
At the end of the day, our project is about informing tailored and adaptive medical interventions that could save and restore lives to what they were before CA. Just as metabolic targeted temperature management revolutionized post-CA care, we hope our findings can contribute to improving clinical practices and ultimately quality of life for CA and stroke patients. Thank you.
Thank you.